there. Welcome to Health Options. It's good to see you in the new year. The shock waves of the coronavirus pandemic have continued to resonate around the world, effectively diverting global attention away from other health challenges that countries were facing. From new and emerging health challenges occasioned by ever-changing socio-economic conditions to dynamic shifts in healthcare delivery, 2021 has been a year of new lessons learned. On this episode of Health Options, we shall take you through a review of the nation's health sector in 2021 and the prospects for 2022. Thanks for joining us on the program. I am Rabi Abdullah. Welcome back. Let's now get down to our review of the nation's health sector in 2021. COVID-19 vaccination topped the events that shaped the Nigerian health sector in the year under review. See how things played out in that regard in this report by Olusheye Adeagbo.
After much anticipation, Nigeria eventually received COVID-19 vaccines in the first quarter of the year under review. Conspiracy theory for vaccine hesitancy, making it a global problem.
People are saying COVID-19 is a scam. I'm not saying it's a scam, but I don't believe it's existing.
In order to deal with its own share of the problem, not only did the nation embark on massive advocacy, but adopted other strategies aimed at convincing the populace about the safety of the vaccines. These include administering the vaccine on the president, vice president, and other public figures.
In many countries have gone very high in their vaccination, 60–70%. We are still at the basic level, and we do hope that all those who are hesitating should participate and see that there is only more good that comes out, and there's hardly any side effect that comes from vaccination.
Nigeria's first phase of vaccination ended in July with almost 4 million doses of the AstraZeneca vaccine donated by the UK government through the COVAX facility.
More encouraging is the fact that the country during that first phase utilized 98.9% of the first tranche of COVID-19 vaccine that were received.
Adjudged a success, the second phase of the vaccination program was launched in August to enhance coverage. The National Primary Healthcare Development Agency (NPHCDA), which drives Nigeria's COVID-19 vaccination program, re-engineered efforts to end vaccine hesitancy by engaging more key players while latching on the same approach that led to the eradication of polio in Nigeria.
We really want to go all out to convince people about the COVID-19.
And so our business will be to continue to communicate the message, and people will begin to respond gradually.
Our response activities from day one have been such that we call all of government and all of society. So everybody that is in the system is one way or the other involved in what we are doing, so that together we can achieve the desired success.
Another disturbing moment came when the media space was awash with the breaking story that more than 1 million expired vaccines were among those being administered on Nigerians. An allegation the health authorities denied, but assured the public of the commitment to safety as appropriate action would be taken on the expired vaccines in their possession. Couple of weeks to the end of the year, the National Primary Healthcare Development Agency, in collaboration with NAFDAC and Abuja Environmental Agency, publicly destroyed over 1 million of expired COVID-19 vaccines.
We've had engagements with the donor countries, and we've made it clear that now that there's an increasing availability of vaccines, that we will not be accepting vaccines that have short shelf lives.
So the most important thing is for us to look forward to manufacturing our own vaccines. That doesn't mean we will not get from others. It is that we will not be totally dependent.
With the federal government's marching order on compulsory COVID-19 vaccination for all federal civil servants, came the flag off of a mass vaccination site across states of the Federation, just as the booster dose was kick-started to enhance citizens' protection against the virus.
What Mr. President has done today is again to indicate to all Nigerians that the federal government does everything to make sure that only safe and efficacious vaccines are brought into Nigeria, and that when they are brought into Nigeria, we'll double check to make sure that it fits the very high standards that have been set by NAFDAC.
What is the outlook for 2022?
We have very ambitious plans for vaccine delivery in 2022 and to have more vaccines, including vaccines to cover booster dose.
In 2022, I think the process is going to be good because people have really accepted that coronavirus is a reality. They have also agreed that there is need for immunization.
Over 13 million Nigerians have now been vaccinated. 13 million Nigerians cannot be wrong. I expect that Nigerians now realize that death from COVID-19, severe illness from COVID-19, happens only to people who are unvaccinated. Please don't take a chance with your life. Get vaccinated.
With a set target of vaccinating 70% of Nigeria's population by 2022, the new year looks promising in the quest to attain herd immunity via the nation's COVID-19 vaccination program. In Abuja, Olusheye Adiagbo.
Let's now get more insights on the country's COVID-19 vaccination story in 2021.
It has seriously stimulated our imagination, and also our fears have been in many ways realizing that when it comes to push, many of the countries which we are very friendly with, who we expected will immediately prioritize support to third world countries, or first of all took care of themselves and did not bother too much about low and lower middle income countries. So that was an eye-opener and led to the thinking that, well, if anything like this happens again, countries should be able to take care of themselves or their region. And that has given birth to the push for vaccine production capacity. Now, it is not easy, but it is a way that we believe we have to go. Perhaps not necessarily for COVID-19 anymore, but you never know what's coming up in the future. Most scientists agree that there will be other pandemics.
2021 has been a year that you could describe as one that had no dull moments, right? There were times when there was a lot of excitement that we're going to get vaccines, and then there were times when the vaccines did not come, especially not in the doses that we expected, not at the time that we expected. But, you know, these are expectations in a world where nothing was so sure, right? Nobody knew what COVID-19 was like in 2018, 2019, right? And we prepared for the worst. And this is why, as a country, we've been able to navigate some of these challenges in a way that has been commended globally. So we look back at 2021 as a year that was full of events, but we also recognize that 2022 presents another opportunity for us to learn from what we did right in 2021, but also improve on those things that didn't work out as well as we thought they would work out. The first and foremost lesson should be that we should produce our vaccines. I have no doubts in my mind that in the not too distant future, the same thing will play out if there's another pandemic. And if we do not have our local vaccine production up and running, we're going to be faced with a situation where we're waiting on the developed countries to finish vaccinating their populations, and then, you know, they will give to the developing countries only those vaccines that they cannot use, only those vaccines that are almost expiring.
The issue of expired COVID-19 vaccines was one the country had to contend with in the year under review. How does the nation intend to guide against this going forward?
What we've learned is the fact that once we're given these vaccines that are almost expiring, then it is difficult to plan carefully. It is difficult for you to forecast very well. All you want to do is just make sure that those vaccines are utilized before they are expired. So no matter what your plans are, you have to just set it aside and focus on getting the vaccines to the communities in a way that may not necessarily allow you to pace yourself.
These vaccines with short shelf lives were gifts that were donated to us by countries who had excess. And when they saw that the vaccines were going to expire soon, they decided to donate them. And the time to process the paperwork to ship them over here or fly them over here and settle them and distribute them, again, takes more time out of the shelf life. So, and if you took a large quantity, you will find that even if you work day and night, you might not be able to use up all of it. So that's what happened. We are now restricting the quantity that we take at a time, and also looking at the expiratory date. We want those with longer shelf lives. So we have asked all our friends, and in fact, I made a plea for our development partners to also impress on our friends who want to donate that once they've decided that they want to donate or gift us vaccines, they should make up their mind early enough and send them out early enough so that the friend you are donating to, the friendly country you are donating to, can still use it before it expires, and not to wait. Because some of our friendly countries are expecting new shipment actually. So they clear the stores to get a new shipment, and they must decide in time so that these vaccines don't get wasted or expired. Nigeria is not the first country to get rid of expired vaccines. It's happened in other countries, but if properly managed and the donations are made early, and we are told now that they are doing that, they are now beginning to decide to send these things out early enough, then they can be properly distributed by the COVAX facility. Most of them come through COVAX and can be utilized before there is risk. The particular batch that expired in Nigeria, we used most of it actually because we had used about 60-70% well before. The one that expired, well, it was we had a good stock of AstraZeneca, which was, but before it got expired, we had already stopped using it. Those ones that we couldn't use anymore, and then it was immediately declared that this vaccine will not be used and they will have to be destroyed. And NAFDAC is responsible for doing that.
First time ever that the president of this country is allocating 5 minutes of an Independence Day speech to medicine security. It has never happened before. The world over, right? Vaccines are just one type of pharmaceuticals. Rest assured that NIPRID is in the middle of any plans for local research and development, as well as local manufacturing of vaccines. It's just that we need to be patient. Vaccines research and development and manufacturing is not a sprint, it's not a 100 meters dash, it's a marathon. It takes a concerted effort. We've taken the key steps, things are ongoing, and Nigerians will be very pleased in the shortest time as regards the interventions that will emerge.
Nigeria was already on course with the booster stage of the vaccination program before 2021 came to a close. As the booster stage continues, there is a very important information those driving the program want the public to note.
We've rolled out a mass vaccination campaign, as you are well aware, making sure that we have vaccination teams in the markets, in the motor parks, in the supermarkets, anywhere we feel that people will be congregating, in the worship centers. And that has afforded Nigerians the opportunity to come close to a vaccination team and take up the opportunity. So we are seeing a situation where, compared to the first and second phases, where say a state might be vaccinating say 3,000 people per day, in the mass vaccination phase, they've quadrupled that level of vaccination. So states are doing so well. So Nasarawa State, Jigawa State, Ogun State, Oyo State, Kwara State are some of the states that have done really, really well. They're among the top 5 performing states when it comes to the mass vaccination campaign. So they have more than increased the daily vaccination rate by 4 times, right? And this is really a result of the governors taking leadership, challenging the local government chairman to say, I've given you the resources you need. I've given you the vaccines, right? You are the leaders of these communities. Go there and make sure that people get the vaccines by putting on the table all of the reasons why they should take the vaccines, sharing the evidences with them, that when you take the vaccines, it protects you from severe disease and death. And we've seen local government chairmen actually go out there, mobilize their councillors, mobilize the directors of the primary healthcare centers, going to communities, rural communities, riverine communities, to make sure that people are aware that these vaccines do work. So now, Mr. President, the Vice President, and members of the Presidential Steering Committee have all taken the boosters. Mr. President has led by example. The father of the nation has led by example by taking the booster shot. That is the direction that we need to take. Following his leadership, take the COVID-19 vaccine so you can be protected against severe disease and death.
Booster, as the word says, to raise. It's something that will raise that efficacy. So that's just the whole essence. And that has been established that after 6 months, that is when that tendency. Of course, it's not the same in terms of the period of time that this efficacy starts to wane. It's not the same for everybody, but because there are other factors that will come into play. For example, whether that person has some disease situations that in themselves can compromise your ability, to withstand these assaults, so to speak. So, but it's been established through what I mentioned, science, data, and evidence that usually after 6 months, these things start going down. So you boost it. So that's the whole essence of the need to boost through the booster dose. We are not unmindful of, yes, vaccine hesitancy and all that. And that's why we continue to work with the agencies of government, like the National Orientation Agency, of course, the entire Ministry of Information itself, and of course, with our partners. We also work with the state government, so that whatever decisions we are taking at the center, it can also go down to the states, the subnational units, and the local governments and the communities. We are also reaching out to all the stakeholders in the system, the traditional rulers, the political leaders, the religious leaders, the community leaders. These are all the market women, even students, all of them. They are stakeholders. And that is why, again, you see, our response activities from day one have been such that we call all of government and all of society. So everybody that is in the system is one way or the other involved in what we are doing so that together we can achieve the desired success.
So the guidance that we've provided from the Presidential Steering Committee is that if you take AstraZeneca, for example, as your first dose, then you should take it as your second dose, right? If you take Moderna as your first dose, take it as your second dose. If you take the Pfizer-BioNTech vaccine as your first dose, take it as your second dose. If you take the Johnson & Johnson vaccine as your first dose, then you can use the Johnson & Johnson again as a booster dose. So these are the 4 vaccines that we use in country. In terms of the boosters, right, in deciding which vaccine we use as a booster dose, we follow the World Health Organization's guidelines, right? Because it's gone through a lot of research, and we're also doing our local researches. And what this guideline is that if you take your AstraZeneca as your first and second doses, then you can take the Pfizer vaccine as your booster dose 6 months after you took the second dose of your AstraZeneca, right? You can also take the Moderna vaccine, but the preference in Nigeria is that you take the Pfizer vaccine as your booster dose, okay? For the Moderna vaccine, you can take Moderna vaccine as your booster dose. If you took 2 doses of the Pfizer-BioNTech vaccine, then you should take the Pfizer vaccine as the booster dose. I mentioned earlier that if you took the Johnson & Johnson vaccine, which is a 1-dose vaccine, the booster dose should come at least 2 months later, okay? Again, you use the Johnson & Johnson. So pretty much that is the guideline that we've provided from the National Primary Healthcare Development Agency.
Before we wind down on our focus on the nation's COVID-19 vaccination story, as part of a review of the health sector in 2021, I urge you to listen, enjoy, and take action from this song that those who have cause to visit the National Primary Healthcare Agency office, for one reason or the other, will be familiar with.
Yeah, yeah. What are you waiting for? What are you waiting for? Millions of Nigerians have received COVID-19 vaccine. I have taken my own. What about you? We have taken our own. What about you? I am strong and healthy. What are you waiting for? What are you waiting for? We are strong and healthy. What are you waiting for? What are you waiting for? Go get, go get, go get, go and get your job. The hospitals, churches, and the mosques. Go and get your job. Health centers, hurry up now. Don't be late. Go and get your job. Bye-bye, Corona. Bye-bye, Corona. Go and get your job. Bye-bye, Corona. Bye-bye, Corona.
That does it on this episode of Health Options. Our review of the nation's health sector in 2021 continues when next we come your way. A reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Hope to see you again.